intersectionality is a core component of any topic. And when we talk about intersectionality, we're talking about people's overlapping and interconnected identities and experiences. And in order to do that, we need to talk about this to understand the complexity of prejudices and privileges. And before we go any further, I want to take time to honor the roots of this social justice work and attribute credit to Kimberly Crenshaw for her scholarship around coining this term intersectionality, which she first shared in the late 1980s and 1989, that came out of critical race theory and feminist theory. And Crenshaw does note that this was not new in 1989 and is not new now, especially for folks who have marginalized identities and multiple marginalized identities, that there has been work done, especially work by many women of color that's often silenced and erased, that attributed to this.
So I think something that's really important when we consider intersectionality is sometimes we just consider the ways in which different layers of identities, you know, manifest themselves for specific individuals. But I think if we look at community settings and community spaces, the different intersectionalities that are present for a whole community, I think is really important to consider. And for a lot of this discussion, I'm going to be speaking from the perspective of my Dearborn community. And this is, you know, my own perspective, my own journey navigating through my community. And Dearborn is a really culturally entrenched community. We have a really large immigrant population. And we have, you know, people who come on their immigrant journey to Dearborn who bring back their traditions and cultural norms that become, you know, intermeshed with the societal and cultural norms that already exist in Dearborn. So our community organizing work has been really, really interesting. Our faith community, you know, we have a really large Muslim and Christian population in Dearborn. So we really make sure that we're able to integrate both of those faith communities in a lot of the work that we're doing. And apart from just having the faith community, when you intermingle race and ethnicity into those faith communities, you know, the work shifts a little bit and it's going to look a little bit different. So I remember, you know, when we were approaching one of our faith institutions, it was a mosque. And for those of you who, I hope everybody is pretty much aware, but a mosque is the house of worship for Muslims. So we went to the mosque and we were talking to the faith leader and we were like, you know, like you need to like make a stand and take a stance against domestic violence. And you need to tell your whole congregation that domestic violence is not acceptable. And the imam looked at us and he was like, whoa, whoa, whoa. Like, if you want me to go and like command and demand all of my congregants to just absorb this view and this viewpoint and automatically adopt it, he's like, that's not the way that we're going to be able to do the work in our community. So we had to really like go back to the drawing books and try and understand how we're going to be able to do really intentional and sustainable work. And that's where I learned that you need to meet your community where they are at. So I might be ready to go into my community and tell everybody like, you know, we need to just take a stand against all of these things that are wrong in our community and all these injustices that a lot of these different community members are facing. But if our community members are not even aware that domestic violence exists or presents a threat or a problem to many members of our community, there's going to be, you know, like we're not going to be seeing eye to eye. So I think understanding, you know, the intersections and the way that they play out is really, really critical because it'll, you know, directly impact the work that you're doing and the way that you will execute that work.
Thank you, Amanda. I'm going to bring a little different lens. Amanda brought some of the prevention-related efforts, but I would also like to put it in perspective with my own identity. Just to give you a few examples of how, you know, I think I saw it as even risk and protective factors when I was looking at myself and my identity and in relation to intersectionality with this during this workshop, and I was thinking about my own identity and how that might play a role. My examples would be in that context. So I identify myself as a female playing many multiple roles, you know, as a wife, a mother, a caregiver, a daughter, a colleague, a friend. I also speak 3 different languages, right? I speak English, I speak Hindi and Telugu. Many people may not know Hindi or Telugu, but they know English. My previous workplace allowed me to use all the 3 languages. My current workspace, you know, I can be very comfortable just speaking English. But many people, when you see me, assume that English is my second language. I have, you know, it's an assumption that I have faced. Another thing is with an education background, right? Sherry introduced me as saying that, yes, I did my bachelor's degree in medicine and surgery in India. I came here to the US, I did give the required USMLE exams, but I didn't pursue by personal choice. I wanted to take care of my kids, took a gap in my working career. But when I wanted to get back into work, it was not an easy journey at all. It's multiple things, you know, lack of access of resources, lack of awareness of supports, and also, you know, you can't get back into the career that you might have had a degree in. I've also witnessed that even people with master's degrees, that education is not recognized here in the US. You have to go through additional training and supports to get to be able to work. Otherwise, you have to just try and work any minimal paying job. There is no equal access to jobs. And I feel like for me also, even working in this field, I think it came across my own community, working through a South Asian community that gave me that working opportunity with no experience, right? I had a long work gap and I didn't have experience in the field. And I think it was my own South Asian community that gave me that access. I don't know if I had gone without any work experience, if I would have got that same opportunity in a mainstream organization or any other workplace. So that is one of the other aspects I wanted to mention. And also I do say that I consider I am a first generation immigrant in this country. And I have witnessed both through work and myself that there are wide gaps in services and access to resources and opportunities. So I feel very motivated with those, knowing those things to do the community organizing and relationship building also, keeping all those factors in mind.
Yeah, I just wanted to highlight your point. I wrote it in the chat box already, Phalguna, but the point around, you know, when most immigrants who are extremely well educated in their home countries come to America or other countries and their degrees or certificates are not recognized, they do have to take, you know, other jobs that don't really fit into the profession that they had in their home country. So, you know, you'll see doctors from various different countries who drive taxis or own, you know, liquor stores or gas stations or what have you. But that feeds into the assumption that most immigrants are unskilled or uneducated, which further feeds into the assumption that, you know, immigrants feed off the system and don't really contribute anything to society. So I think it's really important that you bring up that point. Because most of the immigrants that come to the States or other countries are actually extremely well educated and highly skilled, and they have a lot that they can contribute to society. So thank you for bringing that point up.
I think too, it brings up the points that we hit when we do prevention work, that folks, no matter like how they contribute, how they like have jobs, or if they don't have jobs at all, that they're still valuable, and that we can't measure someone's worth by what job they have, or what level of degree that they have. And we, for planning for this, the three of us, really wanted to center today on ways that we've had to come together to dismantle white supremacism in the work that we do. And it looks really different for all of us. I think for me, it's this twofold piece as being a white woman doing this work and having a responsibility to call in my own white supremacism in other areas, and also coordinating different projects across the state. And so having a really, really different role than Phalguna and Amanda, than working in a specific community, but like transcending kind of a lot of communities across the state of Michigan, and really relying on them as the experts to guide me. And Amanda, you brought up this, such an important point of, in community, oftentimes what we're given when we get write for grants or get funding to do things is a way that's presented for us to do the work. And when we're working in community, oftentimes those ways don't work for the communities. There's not a toolkit that you can download for the communities in which we're going to be talking about that works. And I think it goes to that white supremacist value that there's only one way to do this, because there's not. And honestly, if we're being really authentic, the three of us have had to restructure and redraft our plans so many times that the other day I looked at the first draft that we had, and almost nothing is how we're doing the work. And that's not a failure, that's a success, because doing this work is doing constant revisions. And by allowing us to do that, we're not holding the work in time, and we're not holding each other in time either. We're allowing the work to grow, and we're allowing each other to grow.
Yeah, so we've had this conversation before, like me, Amanda, and Phalguna had this conversation around a lot of different funding streams, right? And it's like they have this like concept of like one size fits all. So it's like, yeah, they'll give this project to somebody who's doing work in a rural community, somebody who's doing work in an urban community, and somebody who's doing work in a culturally specific community. And they want the work to look the same in all of those communities, but the communities all look different. So yeah, like I'll be the first to say, when we were doing greening work in Dearborn, I mean, it took me a long time to be able to find out what is going to work in my community and what's not. I was stuck on the idea of community gardens for like the whole year, and community gardens would never have worked in my community because it's just not a necessity at the moment. It's not a need, right? Whereas like Phalguna doing the work in Detroit, which is only like 10 minutes from the city of Dearborn, community gardens are essential to the lifeline of residents in the city of Detroit. So yeah, it's shifting and molding the work to really fit your community. And if you're working with a funder who, really wants you to have certain outputs and deliverables that will not work for your community, then I think it's definitely worth revisiting that conversation with that funder to let them know, that your community and you've assessed your community needs, and that the work is going to need to look a little bit different. Which goes back to the white supremacist, culture and way of thinking, right? That Amanda stated already, is one way of doing things, and, one size fits all model that does not work for all communities. But as far as prevention in Michigan goes, we really are focused on making sure that our work remains, these 4 things remain at the core of our work. So Phalguna touched on, the work remaining survivor-centered. A lot of times, survivors are left out of multiple conversations when it comes to the needs of those survivors. And rather than survivors writing the narratives of what they need, it's kind of imposed on them. And I'll speak on this a little bit from an Arab American and Muslim American woman perspective, as far as Islamophobia goes and the savior complex, right? Of like white women or, you know, white communities seeing Muslim women who wear hijab or Muslim women in general as being oppressed. You know, they wear the hijab, they're so oppressed, you know, they're, you know, told to wear that thing on their head, that scarf, and, you know, they can't make their own decisions. So when that is said, and we have this sort of savior complex that manifests itself, right? We have this group of women who are creating this narrative, this false narrative that people are supposed to buy into and that they expect Muslim women to adopt and adhere to, rather than asking Muslim women, you know, what are the needs that you see in your community at the moment and how can we help you address those needs? So inviting them to the table to help, you know, write their own narrative. And I think when we think about survivors, you know, it's the same type of concept, you know, at least from my own perspective. And I'll just go through these really quickly because I know we want Amanda and Phalguna to also, you know, give their thoughts. But trauma-informed, of course, really making sure that we're remaining aware of the trauma-informed practices that can center a lot of our work. Anti-racist is, you know, at the core. And then we talked about intersectionality already. Making sure that we're remaining inclusive in our work and acknowledging different identities and the way that they may manifest in the work that we're doing.
And I think being authentic that this isn't always how the work has been done in the state of Michigan, nationally, and historically. A lot of folks weren't able to center their own identities, and not erasing that from the story that we have is incredibly important, especially when we're doing work to build community. To say that, you know, I've only, you know, been doing this work for this amount of time, but that doesn't mean that historically there hasn't been harm caused, and really being authentic about the growth process that we're on, and being open to being accountable. And so for all of us, it's been having series of conversations as we're engaging in the work that we're doing on how are we holding ourselves accountable and how are we being held accountable by others, and being open about what that accountability can look like on those different levels. And I said in the beginning, prevention in Michigan is not to be seen as, you know, the opposite side of intervention in Michigan. So we're working really, really hard to de-silo prevention and intervention, and having both be done in this trauma-informed, anti-racist, intersectional, and survivor-centered, survivor-led way, because prevention and intervention complement and strengthen each other, and both are necessary for the work that we do.
I just want to add one aspect that we, you know, when we're talking about prevention in Michigan and specifically with Detroit, we did definitely have to initially, right up front, we had to, and I really appreciate that we had our team leaders, Amanda and Jessica, who gave us that time to understand that we were not goal-centered, time-centered. You know, it was very important for us to have that because we could take our time. We could spend time to research and understand what is already existent in Detroit. So that was something that we did take, we took quite a few months to try to understand. We took different opportunities, but it is very inspiring to see that, and it's amazing the different kinds of greening efforts that take place in Detroit. As Amanda from Dearborn mentioned, some of the things are very unique to Detroit. It's not just community gardens. The city takes its own initiatives, but the city, when it's taking its own initiatives of revitalization, the local parks and streetscapes, lighting and roads might be a part of those initiatives. Some of them are developer-based, which may or may not be appreciated by the local community. So those are some things that do play a role in those efforts. But there are other very community-led organizations, community development agencies, neighborhood block clubs, individuals who are doing also different kinds of local community gardens, urban gardening, and different kinds of greening efforts. So I think, as Amanda mentioned, the prevention work all across Michigan will look different, even if we say greening, and it's very limited time also that greening can be done in Michigan when you look at the cycle of the year in Michigan. So that is something that I wanted to mention during this slide.
Thank you, Phalguna. And before you all transition, you have a question from Ray. What are some of the specific steps you have taken to de-silo prevention and intervention?
Yeah, that's a really great question. I think that for us, one of the things that we consistently do is restructure narratives that prevention it competes with intervention, and it's getting folks to understand that survivors ask for violence not to occur, that that when we sit and when we work with survivors in intervention, oftentimes something that they say is, I wish that this never would happen, and I don't want it to happen to anyone else. And that prevention work strengthens the intervention work. It isn't to be seen as competing, and in fact it's changing the narrative to folks that there's already such a scarce amount of resources for all of us to do our work, that instead of challenging the people who hold the resources and getting more equitable resources to be able to dismantle systems of oppression, we're left fighting with each other. And that is exhausting, and that is design, and how systems are designed is to do things like that. And by falling into that narrative, that is what we're doing. And so it is, building community around that on one level. And I'll let Amanda and Phalguna chime in as well.
Yeah, so I think Amanda's point around, having this unbased competition between prevention and intervention has really done a disservice to a lot of survivors who would navigate the intervention route. So if you have clients who want to access mental health services through intervention programs, rather than being able to provide a more comprehensive and well-rounded model of care, rather, and I'll speak from my own experience at the agency that I worked at. A lot of the work that I did was extremely siloed. And I think it's because people see them as two completely different routes of addressing different issues within the community space. And I think because with intervention, sometimes you can see tangible outcomes, whether it's client experience, numbers of clients who are transitioning through the program, and all of these different things. And, the funding dollars are there. I think that's why people sometimes take intervention work a little bit more seriously. With the prevention work, because sometimes community change takes a really, really long time to happen. And to see the results of that community change takes sometimes 10, 15 years. And as
what's happening?
Sorry. As I think somebody's unmuted. But as human beings, we tend to be extremely impatient and we want to see tangible outcomes, you know, instantly. So I think that those are some of the different caveats that kind of silo prevention and intervention. But the coalition really has done a fantastic job of really trying to integrate prevention-based services and intervention-based services under this umbrella, and really have different experts and people doing the work come together to learn from each other and empower each other. So I think sometimes it's as simple as that, as having all those people in the same room and having them just talk to each other. Because I feel like sometimes, you know, they're in a lot of different rooms a lot of the time.
I think that we do training too on how to restructure agencies' funding so that way folks aren't solely funded by single sourced grants. And so when you have, when you can leverage different funding streams across multiple individuals, instead of, you know, having one person who does prevention and one person who does this, when you have people's time that are allowed to work on multiple projects, you grow the expertise and you allow for people to recognize that folks are doing prevention work whether they realize they're doing it or not, and being able to leverage that in different ways with dollars. And there are specific trainings on that, but those are just a couple of the ways that we are working to de-silo that.
Thank you, Amanda. And I just wanted to let you all know you have approximately 14 minutes left in your session.
Thank you.
All right, so dismantling white supremacy. And this is so interesting because I have started my master's program and this has been like the topic of conversation in a lot of the different classes that I'm involved in. Right now, I'm not sure how many of you are familiar, there's something called the Scholars Strike that is going on across university campuses across the nation, where, you know, school faculty and staff and student instructors and students are really like taking a stand against, you know, racism and police brutality, and are asking universities to do the same. So I think that talking about dismantling white supremacy or just white supremacy in general is really essential to be able to understand a lot of the work that we're going to have to be doing. And, you know, this concept of, you know, the way that white supremacy shows up in a lot of the different work that we're doing has been mind-boggling for me, at least, because when I first started doing the work, specifically around greening urban spaces, and Amanda Barratt can speak to this, and so can Phalguna. I felt like I was doing like no work at all, although I was doing work, but this need to produce and like produce results right away and produce really good results really took a toll on how I was doing the work, because I no longer was thinking about, oh, like I need to really do like good, intentional and sustainable work, but it's like, what work can I do right now to get the best results, to get like the most media press in the community, to be able to show to the funders that I'm doing really good work. And it really wasn't until I was able to see how white supremacy has infiltrated a lot of the different sectors that we work in and has kind of molded the way we tend to think about work, that I was able to really understand, you know, the still long-lasting effects of white supremacy and the impact that it has on us as communities. But I did want to share, one of my friends shared an article with me about white supremacy culture and the different characteristics that it has, and how, you know, you can have these antidotes in your own workplace. So I shared it in the chat box, and it's somewhat of a long article, but it's really interesting to be able to read through everything and then relate it back to yourself and realize how much of this that we've internalized and absorbed, and how a lot of it is produced in our daily interactions. But it's definitely worth taking a look at, you know, even something as you know, everybody tends to say like, I'm such a perfectionist. I'm such a perfectionist. Like, everything needs to be perfect. Everything needs to be in order. And it's like, we're human beings and mistakes are okay, right? But if you read the article, it'll show you that that's a byproduct of white supremacy culture. So it's definitely worth taking a look at. But yeah, I'll pass it to Amanda and Phalguna.
So based on the work we had to do in Detroit, I definitely feel that we had to go be authentic in our efforts in looking, as I mentioned earlier, that we had to do the research to know what is already present there. And it was important for us to know what our role was as well. Like, I think internally as a team, we repeatedly spent a long time to think about what is our role? What are we going to do when we go there? We are not really creating green spaces. We don't have funding for these green spaces. So how are we really build these relationships? And we had to be honest about it. So even when we met with these community partners who are doing the greening work through various efforts, right? Like we would look for opportunities. It had to be like, we had to keep an open eye for community events that were happening, and then recognize agencies, keep our eyes and ears open for those agencies who are doing the work or individuals who are doing the work to make those connections on a persistent one-on-one basis. And then we had to be good listeners and then also let them know that we are here only to listen to them and support them as we could. So those were some of the important things that we had to do. And I wanted, one of the other things that I felt like I am not a resident of Detroit. I am not, I don't identify myself as the majority of Detroit. I am a person of color, but I am not a Black American. Yeah, I'm not from the community. But I still felt like, I had to remind myself. I wanted to bring this when earlier the topic of anti-Blackness came. That was also something that I had to be conscious of to not allow me to stop my efforts in being present and doing the work we need to do. So those are some things that I had to work on my own as myself as an individual. I just wanted to share some of those examples in this context. Amanda?
Thank you, Phalguna. Amanda, before you go, there is a question in the chat. And it's, can you let us know where this image about dismantling white supremacy comes from? Is this a framework you came up with, or does it come from somewhere? I so appreciate all these words: empathy, vulnerability, consistency, transparency, etc. And in addition to that, you have 7 minutes left.
Perfect. So we created this image actually. And so when Amanda, Phalguna, and I have been talking together about how we built community with each other and how we have done this work for the last few years together in our own communities and together, these things on the outer ring were the core tenets of our pieces of success. This is how we made it happen. And really dismantling white supremacy was what we've been working to do. And I think I can't uplift what the two of them have said enough. Like, for us, we had to be really vulnerable at periods of time and decenter this sense of urgency and this focus on deliverables. And especially with the impact of COVID-19, a lot of the work that we have been doing is prioritizing people. So we've put people over deliverables because that's what prevention is. Prevention isn't a toolkit, it's not a paper, it's not a report, it is building community. Prevention is listening, it's listening to our communities, it's listening to each other, and it is showing up for them and it's showing up for each other. And it has been this journey of the three of us in calling in white supremacy when we see it, And we've all seen it as a group, as individuals, in our agencies, in our communities, and working to dismantle that.
Thank you, Amanda. You all have 5 minutes left. So what parting words would you like to share? What would you like everyone to take away?
Oh no, I feel like we didn't even get through half what we wanted to talk about.
It went by really quickly, but you've all shared so much rich and valuable information. So I really appreciate you.
Thank you, Cherie. I can go ahead with my parting words. I think what I started this conversation with around being authentic and being genuine in your interactions, especially when developing community partner relationships, is going to be critical to the work that you're doing. Helping your community acknowledge problems that do exist in your community is going to be so vital and important to also doing the work. Do not assume that your community is ready to take on an initiative when they don't even acknowledge the problem exists. And having those really hard conversations in your community. I mean, I can't even tell you how many times I have been turned away. I have been shut down. People have said no straight to my face. If I wanted to do domestic violence prevention work or host a workshop or an event, how many people like laughed and didn't even see it as an issue. And understanding like you're going to have those interactions, you're going to have those encounters, but it shouldn't dissuade you from doing the work. The work should be at the core of all of your interactions. And if you're passionate about the work and you know that you're going to be helping your community in the end, people are going to be able to see that, and people will appreciate the work that you're doing. It might take a really long time, but really assessing your community and what will work for your community was vital to my work. Understanding that community gardens are pivotal in the work that Phalguna is doing in the city of Detroit. And for me to understand that community gardens would not work in the city of Dearborn, even though they're only 10 minutes away from each other, and reframing what that greening work would look like in my community was really integral. And also find an organization like the Coalition to work with, because I cannot speak enough about how amazing these women are. And part of dismantling white supremacy culture is also finding a community that empowers each other, and to work with such an amazing group of women who uplift and empower each other on a daily basis was the most pleasant part of my day, and all of my interactions with the Coalition were amazing. So really make sure you surround yourself with really, really good colleagues to work with.
Thank you, Amanda. Phalguna?
I don't have anything to add at this time. I saw that we have only 1 minute. Amanda, if you have anything to add, because I think Amanda, she shared what I wanted to, I would have said too. So.
Yeah, thank you all. I think it's all of our job to dismantle systems of oppression, right? And we need to support each other when doing this work. We need to hold each other accountable. We need to hold ourselves accountable. We need to acknowledge and like understand our privilege and have somebody that you can, process with, is what I'll leave everyone with. Thank you all. Our contact information is right here. You also have it on your agenda. I'm sure you also could probably email anyone from the National Coalition, and they could get you in touch with us. We would love to continue to connect with you all.
And Amanda B., you said people over is prevention. What did you say? People over paper? What did you say?
I said
People over
prevention isn't a paper or a report.
Okay.
People over deliverables.
Yes, that's it. That's prevention. Thank you.
It's in my notes.
Okay, got it. Thank you.
Thank you, everyone.
Thank you.